When I was a medical student, we used to learn a differential diagnosis, and the last thing, number 20 or 25 on the list, would be genetics. We've learned in the last 10, 20 years that that should be totally different. Definitive diagnoses help guide management, treatment, and follow-up, and can save both time, money, anguish, improve quality of life, and overall experience of the patient, the caregiver, and the doctors involved and the medical teams involved are improved when genetics is involved in the patient care. I've been appointed as the new head of medical genetics at Tygerberg Hospital. That's a very big honor for me to take up this role because I see genetics as becoming something that's very important. When we look at genetic conditions, if the diagnosis comes earlier, we are able to mitigate further investigation that is unnecessary, often invasive, often very expensive, often done serially. That's all time and money that's taken from the hospital, both in terms of space and in terms of healthcare workers' time. And when you make the diagnosis early, you can put the patient most times on the proper therapy, so they don't come back to the hospital as often. They don't need any further investigations that we would have done without a diagnosis. This improves quality of care for the patient and quality of care for the healthcare workers as well. It's also important because the more genetic diagnoses we make, the more understanding we have of exactly what's going on in South Africa. We are now in generation genome. So we are looking at next generation sequencing, not only exome sequencing, we are now currently doing genome sequencing on a research basis to be able to unravel exactly what's going on, not only for rare diseases, but for any disease that has a genetic underlying cause or contribution that is genetic in origin. You know, one of the oft repeated mantras that I always hear is genomics is not a priority for Africa because it is very expensive, and because we have other priorities like TB or HIV. My answer to that is that, you know, a patient in the ICU in bed number 1 versus bed number 2 should have equal access to what they need in order to improve their care, their management, their treatment, and their quality of life. Genomics is not that expensive if you think about it in the greater scheme of things. So a test, an exome test, for example, costs between 7,000 to 10,000 rand. And if you think about it, we are then preventing them from undergoing hundreds and hundreds of thousands of rands worth of tests in the long run that would not have benefited them. So I'm on joint staff between Stellenbosch University and Tygerberg Hospital. That means that we have access to what is available on campus, and we have the biggest genomics facility in Africa housed within the BMRI here at our Tygerberg campus. That means that my patients in Tygerberg Hospital have access to the world-class technology that is available in the best centers in the world. And the hope is that it's not only, you know, accessible to Tygerberg Hospital patients, but to the rest of South Africa and to the rest of Southern Africa and perhaps even the rest of Sub-Saharan Africa. So that's the dream, that we are able to make genomics more accessible, more equitable, and get more access to everyone who needs access to the testing.